Hello everyone. So this video is about herpes test interpretation and when to seek suppressive treatment. So here's a clear breakdown for herpes testing interpretation and when to consider suppressive therapy, long-term antiviral medication such as acyclovir, valacyclovir or famciclovir. So there are two main types of herpes. HSV-1 usually oral but can cause genital infection. HSV-2 usually genital. Testing is usually when there's active lesions. Testing is usually by swab and PCR testing of a sore or blood test when we check IgG and IgM antibodies. Swab PCR is from active sore. If it is positive for HSV-1 or HSV-2 DNA confirms active herpes infection. Negative does not fully rule out herpes if the sore is healing because the virus levels may be too low to be detected. Then you have a serology testing done, blood test, IgG and IgM testing. IgM testing usually is positive when there's infection and it suggests early infection, new infection, but it's an unreliable test, lots of false positives. So we're going to focus on IgG positive test. IgG HSV-1 positive means oral herpes is in most cases they're oral, but sometimes it could be genital because of oral sex involvement. Now HSV-2 IgG positive strongly suggests genital herpes. Now if somebody has negative IgG, likely no prior infection unless there was some recent infection because IgG takes about 2 to 12 weeks to develop antibodies. So you got to keep that in mind. When to consider suppressive treatment? Suppressive treatment means daily antiviral medication to reduce outbreaks and transmission. Indications: frequent outbreaks, more than 6 recurrences per year, severe or prolonged episodes that affect quality of life. So that's called frequent outbreaks. Severe symptoms: painful, long-lasting outbreaks, complications, sometimes bladder obstruction, nerve involvement. I have a patient who had it many years ago and he had such a deep nerve pain in the perineum that I can't even explain it to you, and is on high dose of gabapentin. Reducing transmission risk. If your partner is HSV negative and you want to lower the risk of transmission, then you can be on suppressive treatment because suppressive treatment can reduce the transmission risk by 50%. But if combine that suppressive treatment with condom use, you can reduce transmission by 80%. Immunocompromised patient, they're more prone to develop severe frequent herpes infection. Patient with AIDS, or patient on chemotherapy, chronic liver disease, chronic kidney disease within dialysis or chronic steroid treatment, etc., etc. Psychological burden. Some patients choose suppressive therapy because they have anxiety thinking about outbreaks is significantly affecting their life. In that case, it's a peace of mind thing. We will put patient on suppressive treatment. Episodic therapy, we take antiviral only when outbreak begins, shortens healing time, and if started early. Usually treatment is for 7 days. Suppressive therapy, you take antivirals daily to prevent or minimize outbreaks and transmission. Bottom line, if you have HSV IgG positive, usually genital herpes, consider suppressive treatment therapy if frequent, severe, or transmission risk is a concern. If you are HSV-1 IgG positive only, often because of cold sores, and suppressive therapy is not needed unless it's frequent and severe. So somebody getting cold sore every month, every 2 months, and it affects their mouth and oral cavity, then yeah, you consider that. So So you need to talk to your doctor, and doctor can definitely tell you your treatment. Um, so what happens when you have HSV-2 IgG positive and no symptoms for years? A patient of mine in mid-50s saw it recently. He said he had herpes when he was 18 and he had lesions. And since then, he didn't have any recurrence of any lesions or any pain. And he said, I want to be on suppressive treatment. Then I had to explain it to him. I'm going to explain it to you again. So in that case, virus is dormant in nerve ganglion, which is part of the spinal cord where the nerve comes out before it branches off. So it's a ganglion, there's a collection before nerve comes out. Many people never have recurrences after the first episode. Or sometimes they even have mild one and they have not noticed it. But the thing is that you have virus, it can still be shed asymptomatically even without visible lesions. So how do you manage? If truly asymptomatic after the first outbreak, like in this case, my case, one of my patients, suppressive therapy is usually not required. Most guidelines by CDC, WHO, or ACOG recommend episodic therapy only if outbreak occurs. But if the patient is getting anxiety thinking about, passing on to partner or whatever, in that case, you can definitely opt for suppressive treatment. Because patient is worrying about what if you're gonna pass on to HSV negative partner. But other thing is that if this patient for any reason becomes immunocompromised, because just think about he's on chemo or developed HIV or on long protracted dose of steroid. So in that situation, reactivation can occur and it can be severe. Of course, if they have anxiety issue, thinking about transmitting HSV even without outbreaks, is cynical situation. But we need to address that and usually start treatment, and it's well recommended as well. Counseling patient, asymptomatic shedding happens in 10 to 20% of days, most common in the first few years after infection, but decreases over time. In this case, 40 years later, it's very unlikely. So use condoms, disclosure, antivirals if chosen together, they lower transmission risk substantially. Routine monitoring. Bottom line for this case, no symptom for years, no medical need for daily suppressive therapy. I offer the patient choice that it happens. Any lesions, we can treat it. And he did not opt for daily suppressive dose, and he does not have any anxiety issue. So sometimes reassurance and knowledge, education works great for a lot of folks. And if the doctor can explain the logic behind it and what the science behind it, most time it works out very well. But sometimes it does not. Then we just put them on suppressive treatment. So thank you for watching.